Chapter 5. Complications, what to watch for, and how you can help to prevent them. As with any surgical procedure, all natural breast reconstruction carries with it the risk of complications. These include both complications at the surgical site, as well as systemic complications that affect distant parts of the body, such as the heart or lungs. These complications can be conceptualized as occurring in three distinct timeframes: short-term, medium-term, and long-term. Short-term complications, 0 to 2 weeks. The short-term can be thought of as the first few weeks after the operation. One potential risk is clotting in either the artery or vein that was reconnected during the tissue transfer procedure. This would be an emergency, not because it would put the woman's overall health at risk, but because if it were not identified and fixed promptly, the transferred tissue would not survive and would need to be removed. Fortunately, changes in the blood flow are extremely rare, usually happening only 1 to 2 times out of 100 flat procedures. And if it is identified within an hour and then promptly returned to the operating room, the likelihood of successfully saving the tissue is high. So the overall success rate for permanently good blood flow is over 99%. And furthermore, if any changes in blood flow were to occur, they would almost always happen within the first 1 to 2 days, and would almost never happen after 4 to 5 days. So once a woman who has undergone all natural breast reconstruction successfully makes it through the first week, the chance of blood flow problems for the rest of her life is truly 0%. Another possible complication is bleeding at any of the surgical sites: breast, abdomen, buttocks, or thighs. This usually happens within the first 1 to 2 days after surgery. If it is mild and stops on its own, it does not require a return to the operating room. But if it is more than mild, and especially if it is in the chest and therefore puts the health of the transferred tissue at risk, then your surgeon will usually recommend that you return to the operating room to identify the source of bleeding and evacuate any blood that has accumulated. When the native breast tissue is removed from the skin that overlies the breast, the blood flow to that remaining skin is decreased. If the blood flow is decreased to too great of a degree, that skin is at risk of permanent injury and therefore would turn to scab and peel away. Fortunately, the breast surgeons performing these procedures usually are very skilled and are able to strike the right balance between removing all of the breast tissue in order to minimize the chance of recurrence, but not making the remaining breast skin too thin that the blood flow becomes overly impaired. Thus, the chance of any skin flap necrosis is very low. But if it were to happen, early signs of it are usually apparent within the first few days after surgery. But it usually takes 1 to 2 weeks to go through its full evolution, at which point the scab will either fall away and reveal good, healthy new skin underneath, or else it will fall away and reveal some portion of open wound. This is one of the many reasons why all natural breast reconstruction is advantageous. If there were a foreign body such as an implant underlying the breast skin and some portion of the skin were to turn to scab, it would lead to exposure of the implant, which almost always requires implant removal. This is not a dangerous complication, but an unpleasant one, because it requires that the breast reconstruction be started all over again. If, on the contrary, a portion of all natural skin and fat that had been used to recreate the breast underneath the breast skin flaps, and if that breast skin were to have a problem and ultimately lead to exposure of the transferred tissue, it would not cause any risk of infection because there is no foreign body present. Another great benefit of all natural breast reconstruction. Finally, there is the risk of complications occurring that are not directly at the surgical sites, but instead at more distant parts of the body. One such complication is a blood clot in the deep veins of the body. This is referred to as a deep vein thrombosis, or DVT, and most commonly occurs in the legs. These DVTs can cause swelling and discomfort in the legs, and in some situations, those clots can break away from the original site of clotting and travel in the bloodstream up to the lungs. This is referred to as a pulmonary embolism, or PE. If this were to happen, women's heart rates usually increase, their oxygen levels decrease, and they can feel short of breath. Though there are other less severe reasons to feel short of breath after surgery, a PE is always a possible cause of it, and the possibility of it being the cause of those symptoms must be considered in all circumstances. And in very rare circumstances, the PE in the lungs can be large enough that death can result. Fortunately, this is very, very rare. But given how catastrophic it would be, there are many steps that are taken to reduce the likelihood that it happens. These steps include thorough preoperative evaluation, compression devices placed on the legs for the entirety of the operation and the time spent in the hospital after surgery, and in most cases, a blood thinning injection given during and after the operation, sometimes including the first 1 to 2 weeks while at home. Other distant complications can include heart rhythm changes and pneumonia. Your anesthesiologist will be working closely together with the surgical team to reduce the risk of this happening during the operation, as well as in the early period after surgery. Medium-term complications, 2 weeks to 8 weeks. After all natural breast reconstruction, the medium term can be defined as approximately 2 to 8 weeks after surgery. The first complication that can happen during this period is wound healing issues. Between the breast and the donor site where the tissue is collected from, this operation has a fairly sizable total area that needs to heal. While it is uncommon, there is the possibility that wound healing issues could occur at any of these sites, especially the breast, because the blood flow to the remaining breast skin has been decreased by having the breast tissue removed from underneath it. When skin incision healing issues occur, signs are often apparent as early as the first few days after surgery, but it usually takes a few weeks to actually manifest as a poorly healing wound. Fortunately, if the breast has been reconstructed with all natural breast tissue, exposure of that underlying tissue is of minimal long-term significance, in contrast to what the situation would be if instead an implant had been placed. The second medium-term complication is the possibility of developing a seroma, or collection of body's normal fluid, underneath the skin at one of the surgical sites. While it is not a major issue if a seroma were to develop, it would at least be a nuisance, and at worst be a source of infection that would require treatment. The drains that are placed at the surgical sites are primarily to prevent seroma formation by allowing the fluid a safe way to drain out of the body. The final medium-term complication is injury to the tissue of the reconstructed breast. If the blood flow to certain regions of the fat of the reconstructed breast becomes insufficient, then that tissue can be irreversibly injured, leading to an entity referred to as fat necrosis. This is also not dangerous, but can be painful, unsightly, or firm to the touch. While it often significantly improves over time, especially when aided by massage and warm compresses, there are circumstances where it does not completely resolve, and in those cases it can be surgically removed, usually without compromising the appearance of the reconstructed breast. Long-term complications, 2 months and beyond. Finally, after 2 months have passed since the time of the operation, it can be safely considered to be long-term complications. First, in the long term after all natural breast reconstruction, women can potentially feel limitations of the range of motion at their shoulders. While surgery was not performed on the shoulders themselves, it was performed on the breasts, which are obviously nearby. So even a short period of decreased activity of the shoulders and arms can lead to stiffness. While muscle is rarely included anymore in the flap that is moved up to the chest, the muscles of the abdominal wall are separated in order to fully dissect the blood vessels that supply the skin and fat that will be moved up to the chest. The muscular abdominal wall is then always closed in multiple layers in order to minimize the chance that a hernia or bulge develops. If it does, there are ways that it can be addressed, but the best way to address it is to prevent it from happening in the first place. After surgery, that includes collecting tissue from the lower abdomen. It is recommended that you wait at least 6 weeks before returning to strenuous physical activity. Finally, beginning months after your all-natural breast reconstruction has been performed, the scars at any of the healing sites can become thickened, a hypertrophic scar, or even outwardly protruding, a keloid. Your surgeon should be able to provide you with a scar management plan that optimizes the appearance and functional status of the skin. And if a thickened scar does develop, then a small amount of steroids can be injected into the very surface layer of the scar itself, which often leads to at least a partial improvement in the scar. What you can do to reduce your risk. While your breast reconstruction team will be monitoring things very closely and are ultimately responsible for your well-being, there's no one who is as motivated for smooth recovery as you are. Therefore, in addition to all the care that your team will be providing, there are certainly things that are in your control and thus you are recommended to do. First, follow your team's instructions. While the details may be different, every team you could have directing your care will inevitably provide you instructions about what they think you can do to optimize your result. unless they seem particularly poorly matched for your needs or your abilities, we strongly recommend that you follow those instructions as closely as you can. These instructions were made for a reason, and following those instructions will almost certainly lead to a better outcome compared to if you did not follow them. Second, advocate for yourself. No matter how much you trust your surgical team, you must resist any urge that might exist to be passive in your care. We recommend that you be an active participant and that you advocate for yourself whenever it seems appropriate. If you feel that something is wrong, let the team know. And if you feel like you're not getting a sufficient response, let them know again, and again, and again. Never worry if you're being pushy or over-aggressive or anything of the sort. While there may be circumstances where you feel that something is wrong, and it in fact turns out to be all fine, more often than not, women know when something is wrong. And as providers, we would all much rather hear too much from you than not enough. Third, enlist help from family and friends. Whether you realize it or not, or admit it or not, undergoing breast cancer treatment will very likely be one of the most difficult things you will ever have to do. And no matter how strong you are, and odds are you are extremely strong, asking for and accepting help from others is a sign of strength, not of weakness. As surgeons, we have all seen firsthand that strength comes from facing recovery with a team assembled around you. We have also seen the relative loneliness of facing something like this alone. And though it is not a perfect correlation, more often than not, the women with the team around them recover better. Fourth, ensure that you have a good diet and plenty of water. We are what we eat. And when we are recovering from cancer surgery, this is particularly true. So follow your reconstructive team's recommendations for the amount of water to drink on a daily basis and for the types of foods to eat. Preparing for them, if not actually preparing them, and likely freezing, ahead of time is a great way to reduce the amount of stress that you may experience after surgery. Fifth, perform daily exercise, stretching, and range of motion exercises. Normal daily activities such as walking, sitting, standing, and all the normal things that we do each day are encouraged to be done as early as possible after surgery. This includes range of motion exercises and stretching for the entire body, but particularly for the shoulders. Your reconstructive team will likely provide guidance ahead of surgery about what sort of exercises to do afterwards, and doing so will significantly improve your likelihood of a smooth, uneventful recovery. But in almost all cases, women are recommended to refrain from strenuous physical activity for the first 6 weeks, because that is how long it takes for the abdominal wall muscles to fully heal. An additional benefit of activity is that it helps prevent pneumonia and other lung infections that can happen after surgery. Sixth, avoid nicotine. Nicotine is one of the chemicals in tobacco, and therefore levels of nicotine are increased in women who smoke cigarettes and other tobacco-containing products. The problem with nicotine is that it makes your blood vessels constrict, which decreases the amount of blood that flows in those vessels. And the problem with that is that blood is the river by which healing cells and nutrients and oxygen are delivered to sites where your body needs them. And after an operation such as all-natural breast reconstruction, your body will be in need of healing at a few different sites. If anything is decreasing the amount of blood flow, such as nicotine, then your healing will be impaired. This can lead to wound healing problems and infections. So it is strongly recommended that you eliminate all nicotine-containing products from your system for at least 1 month prior to surgery and at least 1 month after surgery. And if you can then refrain from nicotine-containing products forever, that is even better, both for your healing breast surgical sites as well as your lungs. Seventh, participate in a scar management program. Even without any particular care, most scars heal very well. While it is rare, thickened or painful scars are possible, especially in people who have family members who have had poor scars in the past. But there are simple measures that can be taken that improve the quality of the scars. The scientific evidence behind them is mixed, but the measures include creams and tapes, massage, and injections. Steroid injections into the scar itself can be beneficial, especially when it is performed when the scar is small and immature. Your surgical team will be able to provide you with guidance about how to best manage your scars. If they do not, there are plenty of resources available, and you are encouraged to participate in one of them. If you are interested in more information about different scar programs, you can visit our website at www.hendersonbreastreconstruction.com/scar. Eighth, and most importantly, keep a positive attitude. There is no doubt, in my opinion, that there is a correlation between a positive outlook and good surgical outcomes. The firm scientific evidence to support this is weak, and there are certainly cases of women with positive attitudes who have less good outcomes, and vice versa. But there is no doubt that there's a link between the mind and the body, and as you have control over your mental outlook and how you approach this situation, there is nothing to lose and instead much to gain by having the most positive mental approach possible. Now that we have devoted a lot of time to a discussion of the risks of all-natural breast reconstruction and the things that you can do to reduce the chance that they happen, we hope that you feel empowered with the tools that you have at your disposal to create the best possible outcome after surgery. Another thing that women often wonder about is the financial implications of this type of treatment. The answer to this question includes some very good news and will be discussed in the next chapter. Continue on.